the Premier announcing today his government will lift capacity limits in indoor settings this Thursday and will also scrap the province's proof of vaccination system beginning March 1st.
And that means restaurants, gyms, and cinemas can once again operate at 100% capacity. And the change effectively moves up the second stage of Ontario's reopening plan by 4 days. To discuss these changes, we welcome back to CP24 tonight Dr. Fahad Razak, internist at St. Michael's Hospital and a member of the Ontario COVID-19 Science Advisory Table, Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital, and Dr. Andrew Bozzari, Executive Director of Social Medicine at UHM. Thanks to all of you. Dr. Razak, was this decision about science or politics from a public health perspective? Are we ready to reopen?
Yeah, I can't say that we have numbers to tell you when the right time to reopen is at this point, because truthfully, our ability to predict and estimate these numbers has been compromised by the lack of testing. This is slightly faster than the planned schedule. Would I like it to go a little bit slower? Sure. But I don't have the numbers to prove that to you at this point. And I think the most important thing is to do it in gradual stages. Look for numbers to start to creep up if they do. We've obviously gone through another very difficult wave, so I understand the pressures of why people want to reopen. I just want to see us do that safely, and that's the most important thing. We still have backlogs, enormous backlogs of surgeries in hospital. Let's not have a resurgence so that we start to compromise those numbers again.
Yeah, I guess it's hard to make a big decision like this without all of the data. The leader of the NDP, Andrea Horwath, she said today she thinks Doug Ford is caving to the occupiers. Dr. Bozzari, what do you think? Are we ready?
Yeah, I really agree with the points Dr. Razak has made. I mean, I think we continue to need better data. This has to be gradual. This has to be informed. When you look at a lot of the risks that are in place, we have to see the policies be commensurate with the risks that are taking hold in different neighborhoods as well. So one of the things I think we're calling for is to ensure that, yes, we've had a lot of learnings through this in terms of the policies that are in place. Everyone wants to see the protections be there for people, but not having restrictions that have caused, a lot of sacrifice. And I think, as Dr. Razak has mentioned, we are very concerned in the healthcare system about the backlog and ensuring that, especially for marginalized communities and communities that have not had access to the healthcare system pre-pandemic, that we start to see this healthcare access take place. So I think when we're looking at politics and the science, this is something that, again, we really need to ensure that we are moving with where the data is. And again, I think it's a real challenge with where we are on the testing capacity. So I think we have to be really cautious. But I think, again, it's about the people who sacrificed by stepping up to get vaccinated that deserve the credit for looking out for each other, and not these occupations over the last 2 weeks.
So let's talk more about the healthcare system. Dr. Grill, hospitalization and ICU numbers continue to drop. Tell us a bit about what you're seeing in Markham Stouffville.
Yeah, I mean, thanks so much. The numbers are going down. So, we're having less patients admitted to hospital in terms of COVID-19 than we had when sort of this wave began. But at the same time, as my colleagues both mentioned, we still do have staffing shortages. And, I definitely feel for all of my healthcare colleagues, both in the hospital as well as in the community, primary care, home care. We've lost a lot of people due to burnout. People have been off sick. We are getting those numbers back, so that's good with the wave going down. But, we're still trying to work hard to service our community. So, I am very happy that surgeries are, I think it's up to 70% now. They've started again, especially patients that have been waiting for cancer treatments and other treatments that were delayed. I'm very happy to see that we're getting back to that. But, there are still cracks in our healthcare system that I think we need to focus on and fill while we have a bit of a lull in what's going on with COVID-19. And one of those cracks is to make sure we have adequate staffing in our hospitals, in our healthcare system, so we can serve our communities and give them the care that they need in Ontario.
Dr. Razak, the decision to ditch vaccine passports in Ontario, good idea, bad idea? Is it just too soon?
Yeah, very controversial. And, you've heard a lot of scientists say really a tough decision. Let me tell you why this is a difficult one to call. Right now, the vaccine passports require 2 doses of the vaccine. But unfortunately, because of Omicron and the amount of time that's gone by, 2 doses of the vaccine do not really protect you anymore against transmission. They do protect against severe disease. If you really wanted to protect against transmission, you would need 3 doses. And at this point, I just don't think it's feasible really for the public to move to a 3-dose vaccine passport. And so you're left with a vaccine passport system, which is not terribly effective. There is the protection against severe disease, but at the end of this Omicron wave, the vast majority of people are now either immune through vaccines or by being exposed. And so they start to have reduced value. And that's why people are saying it may not make sense to continue them. And I do think that's why we're headed in the direction we are. Now, look, anytime we say these things, again, be humble in the face of the virus. So as we make these changes, look for numbers to rise. As of now, I think the compelling case for that vaccine passport to continue, at least far into the future, just doesn't seem to be there anymore.
So, Dr. Bozzari, talk about the messaging around vaccination. I mean, how do you convince people to get the vaccine now that we know that we're just weeks away from the mandate being lifted?
Yeah, I think what we need to continue to do is be very open and transparent about the data. Dr. Razak made a great point about with 2 doses, it not really helping as much around the transmission as we were hoping with respect to Omicron. But when you look at the latest City of Toronto data, 3 doses versus 2 doses, for people that are over 60, there's a 7-time-fold difference in ICU admissions. So this is still very significant. We need to ensure that data is out there, that we are ensuring that we're not losing out in this battle against the misinformation in various mediums and spots. And the other thing I think we need to look at is look at the data that we have with respect to who's getting access to a 3rd dose in our city. We see a stark disparity between neighborhoods that are more likely to be racialized and low income versus high income neighborhoods where it's 2 to 3 to 4-fold differences in access to 3rd doses. So we need to do what's been working throughout the 1st and 2nd dose of the vaccine campaign, which is to work alongside our community, really look at the community leadership to get these pop-ups and different ways of low barrier clinics. So we cannot, with the passports or different mandates starting to be lifted, we can't throw out all of the other learnings with respect to paid sick leave and these different barriers that have prevented people. Otherwise, we're going to have COVID, really seizing upon the structural determinants and really following the pathologies of poverty. And you could predict very easily by postal code who's going to be at risk of COVID and who's not. And we can't accept that in a universal healthcare system.
Okay, Dr. Grill also announced today young people aged 12 to 17, they can now get their boosters. Some doctors, though, say there isn't enough evidence to suggest that a booster would actually be effective for that age group. Do you have any advice?
Yeah, I mean, the Ontario government made an announcement today, as you said, that 12 to 17-year-olds can get their booster dose. And I would never say that they shouldn't get the dose, because we know that a 3rd dose will increase their immunity. It'll also help prevent transmission to others more vulnerable. And so I'm in support of that decision. I think where people, though, have to start understanding the nuances is, NACI came out with their announcement about a week and a half ago, and they recommended boosters for 12 to 17-year-olds who had chronic disease. And I think the reason why they did that is they were trying to focus on the populations that would probably benefit the most. I would argue that a healthy 12 to 17-year-old who has 2 doses, even if they got Omicron, the chances of them getting a severe case is pretty low. That doesn't mean you shouldn't boost them and increase that protection. But protecting somebody 12 to 17 who has chronic health condition, very, very important. I think the other thing, too, is that if we are going to boost our 12 to 17-year-olds, as Dr. Bozzari said, we have to make a big effort to get them out and get vaccinated, because the more 12 to 17-year-olds that do get the dose, that's how you're going to help prevent spread to the older, more vulnerable people. And I would agree with my colleagues, we can't forget about the people over 50, over 60 that still haven't gotten their 3rd dose. Even though the wave is on its way down, those people are still vulnerable, which means our healthcare system is vulnerable. So I believe in boosters, but I think we also have to make sure we're definitely focused on the populations that need them the most. And as healthcare providers, we have to continue to work together to make that effort even as the wave starts to decrease.
Dr. Razak, given what we know about COVID now being airborne, when do you expect to see mask mandates lifted?
Ideally, I would like to see those be the very last thing to be pulled away. You can have a mask on and engage with almost every part of our society. Businesses can reopen, kids can be in school, people can be in public spaces and be safe. We need to do this in a progressive way. And right now, I think considering the amount the public has suffered through these waves of lockdowns, especially the restrictions that they experienced over this last holiday period, I think were very punishing. Let's get society as reopened as possible, emphasize the things that have been restricted. So businesses, restaurants, religious gatherings, public gatherings, let people get back together socially. Keep the masks on for now. Let's really get to the other side of this wave. And then acknowledge that, as we enter the summer season, we may go through a really good period. Who knows what the fall will bring? And this again goes to the point of Dr. Bazari and Dr. Grill. That boosted dose, getting vaccinated if you haven't been vaccinated, that's especially important to make sure that this period where we pull away from the virus is as sustainable as possible. And people in Toronto and people in Ontario have proven over and over again that they will get vaccinated and they will do the right thing. And so I hope to see that again, and that will help us get to the point where we can finally remove those masks.
Okay, Dr. Bazari, in a perfect world, we fully reopen, we lift all mandates, and all is good. We never look back. Is that even possible without vaccine equity?
It's impossible. And I think when we all have this, and I think Dr. Razak's point, the public has been through so much. The healthcare system has been through so much. We all want this to be over. We want COVID to be done with. We want this pandemic to end. But the reality is, if we do not vaccinate the world, if we do not ensure that low-income countries where there are billions of people without access to their first dose, and we're having conversations around third and fourth doses, if this does not happen, this is going to be a breeding ground for more variants. It will continue to cause, most importantly, a suffering and burden in low-income countries that really imposes the global health inequities and the punishing aspects because the rest of the world has neglected the fact that billions of people are continuing to be at risk. And I think there's some important points that we have to raise, that this is about holding the pharmaceutical companies accountable, and that really more of our fates are connected than we ever imagined. And I think for many people that was eye-opening in the city when we think about different neighborhoods, but also across the world. So if we don't actually pull together on ensuring that we're seeing a collective outcome, that perfect state that you mentioned, Lena, is going to continue to be a pipe dream, and that's something that we need to push against.
Okay, we'll leave it there. Dr. Andrew Bazari, Dr. Fahad Razak, and Dr. Alan Grill, thank you so much for your time tonight.
Thank you.
Appreciate it.
Stay safe.